Hard Talk with Mwasha. We talk it hard, really hard. Hello Tanzania, how are you? This is your host and friend, Lilian Mwasha, and today I'm very excited. I'm hosting a very important person. Tanzania has received special guests, and I call them friends because we are going to be working together and eventually living together. Lilian Mwasha is my name, and today I am seated with the CEO himself of Kokilaben Ambani Hospital. His name is Dr. Mr. CEO Santosh Shrtty. I believe I pronounced that right.
Yes, you did.
How are you doing?
Wonderful.
Welcome.
Pleasure to be here.
Thank you so much. You just arrived, right?
Just arrived.
What time did you land?
Well, I landed at about 9 a.m. this morning. And
how was the flight?
Flight was comfortable.
Tell me, when you just landed in Tanzania, what did you see, what did you feel, and how did you feel?
Well, as the plane was descending, and, just looking out of the window, and I could see so much greenery, so much nature.
I know.
I think, that's the one thing that really struck a chord with me, because I'm someone who loves nature, loves greenery, loves openness, and, it's beautiful.
It's beautiful.
It's a beautiful city.
Is it the same picture you had before you came in? I believe before you go somewhere, you always have this picture, like, I'm going to Ethiopia, maybe it's like this and like that. Is what you saw, was it the same as what you had in your mind about this place?
Honestly, no, because the perception that we have about Tanzania or about Kenya is more about wildlife. So sitting in India, we always associate these countries with wildlife sanctuaries and all of that. Not so much with the greenery, the ocean, some of those
beautiful
things,
roads,
big
buildings.
So, I'm very, very impressed.
You are in town today. Right now we are at Serena Hotel. I remember you told me this hotel is beautiful.
It is.
So yeah, we have quite a number of such hotels and quite a number of beautiful things in Tanzania. And we're very happy to have you here today. I am going to talk about the hospital. You're in Tanzania. What brings you here? Let's just start from there. I understand you are the CEO, and I want to talk a bit about your position. And guess what? I read about you, and I thought I would meet this big man, old man. You're so young with the position that you carry. So before I ask what brings you here, tell me about your position as a CEO. What do you do on a daily basis?
So, healthcare CEO's job is primarily about managing the affairs of a hospital. And over the period of time, people have begun to realize that healthcare is as challenging as any other business. Traditionally, most hospitals used to be run by doctors or seniors, doctors who had retired or doctors who had given up clinical practice. But in the last decade and a half, actually in India for nearly 2 decades now, you have a lot of professionals getting into running of hospitals, because hospitals are complex places. You have to balance your revenue and expenses. At the same time, ensure that you are giving the best outcomes to patients. Hospitals are extremely labor intensive, so for every hospital bed, you have 4 to 5 employees. So at Kokilaben Ambani Hospital, we have 750 beds, and we've got over 750 beds.
No way.
So it is the largest hospital in the city of Mumbai.
All right. How many nurses are we talking about? Because if you're having 750 beds, then you have plenty number of nurses and doctors and practitioners. How many employees do you have?
So we've got over 3,000 employees. And,
oh my God.
Majority of them are women. So 70-75% of our staff is women.
Women.
That's right.
Powerful.
So I think absolutely.
It's hospitality. I mean, when you talk about hospitality, you talk about women,
right. Also leadership. I mean, the president of Tanzania
is a woman.
Is a woman. The health minister of Tanzania is a woman.
William, yes.
And the chairperson of our hospital is also a woman.
Beautiful. We're going to talk about her as well. How do you manage as a CEO having 1,000 of people reporting to you How is that possible? How many people reports to you directly?
So I've got about 11 to 12 people who are reporting to me directly, and they are the heads of the respective areas like clinical services, operations and finance, HR, IT, facility maintenance, quality, marketing. So we have 10 to 11 verticals, and then they have their respective teams who are working under them.
Who is the closest to you out of the 12?
Oh, well, everybody is, to be honest. I think each one is playing a critical role. Some of them are more front end, because they are involved directly with patient care. Some of them could be back end, but they are playing an equally critical supportive function. So I guess I always say running hospitals is like it's like a harmony, like a symphony. Everyone has to play their part.
Out of the 12, how many are women, how many men?
Well, there are 2 women and 10 men.
Oh,
at this point.
Okay.
But yes, we had 4 to 5 women, but there are they've moved on.
I like the way you said you have more, out of all the 3,000 plus workers, you have more women than men. And a few months before, our president, who is a woman, came to India. Tell us about that. How did you receive her? How did you, because we saw her coming in and the hospitality was actually great. We were very thankful. How did you receive her? And
So one of the things that our current Prime Minister, Mr. Narendra Modi, has been focusing on a lot is in terms of collaboration between countries. And clearly Africa and parts of Africa are areas that he's looking to collaborate at. And Tanzania being a very, very strong partner in his mind. So there are multiple areas of collaboration that we are looking at, and healthcare definitely is clearly one of them, because even now there are a lot of Tanzanians who are seeking medical care coming into India. Into India. They're going to different facilities. Quite a few of them come to our hospital as well. But the long-term goal is always going to be, how do we provide this healthcare to the citizens of Tanzania in Tanzania, so that they don't have to actually go out?
Absolutely.
How do we make sure that the doctors, the nurses, the other support staff working in hospitals here are completely abreast with the latest that's happening? How do we work together in terms of training programs, in terms of fellowships? So we were looking at it more as a completely collaborative kind of approach, and nothing more wonderful than the leaders of the 2 countries coming together at the beginning of this month and exploring various areas of partnership.
Wow.
And I strongly believe that healthcare could be a great area for the 2 countries to work together.
Was our president's coming one of the things that motivated you to, invest in Tanzania or come into Tanzania and start looking at Tanzania on a different level?
We've been looking at Tanzania for some time, to be honest. So it's just a wonderful coincidence that the whole thing has come to fruition in this month, the same month that the president was there.
Absolutely.
But we've been looking at Tanzania for a while. In fact, we've been working with Air Tanzania as well to facilitate some of the patients who needed to come to our country. So we've kind of worked out special schemes and offers. The whole idea is, how do we make it a very transparent experience for patients who want to come, for doctors who want to come to learn. The idea being that we want to welcome them with open arms.
Wow, that's beautiful. What's your vision about the Institute? Let's talk about the vision now. Yes, you're coming to Tanzania, we're going to work together, you're going to make it very smooth for us, but what's the vision of Kokilaben Ambani?
So, the vision of this hospital has really been given by our chairperson, Mrs. Tina Ambani.
Wow.
So she's the chairperson, and when she decided to set up this institute, she said that we have to create something which is a world-class healthcare institution, something which is comparable with the John Hopkins, the Mayos, the Cleveland Clinic, that people associate the name with excellence. And that can only happen if you not only deliver clinical care, but you're also having a focus on academics, research. So it's this whole triad which has to come together for us to build an institution. So there are many things at our hospital which are unique for the region. For example, our hospital is one of the only hospitals in the city to be running on a full-time specialist system. So all doctors exclusively work full-time at the hospital.
Wow.
So, I mean, along with me, currently I have 3 other senior colleagues of mine who've come, who are very, very senior doctors in their respective fields, but they exclusively work with us. So they don't go to any other hospitals. There's no private practice, no other attachments. So from a patient-centric point of view, this model works best because the patient knows that my doctor is available full-time in this building. In case of any complications, any help that is needed, he can just simply come up and see me. It's not that he's at the other end of town, he'll take an hour to come or some assistant.
So that means they're being accommodated, doctors are accommodated within the hospital.
That
Their
is
families are there.
They live close by.
Okay.
So all doctors working here, they live very close to the hospital, barely in a radius of 1 kilometer or 2. So in case of any emergency, they are able to come immediately, even in the middle of the night. And during the day, they are all over here. So the other important thing from a vision point of view that she laid out for us was in terms of filling up need gaps. So there were many services, even in a city like Mumbai, which were lacking. But she said that let's go ahead and set up some of these services. So we set up a Children's Heart Center program.
Fantastic.
You know, we have Dr. Suresh Rao who's come with me and for the launch of this office, who's the director of the program. And where we operate children, newborn babies, blue babies, babies as young as a few hours old or a few weeks old, the blue babies as they say. And we have outcomes, success rate of 99%.
Wow.
Comparable with the best hospitals in the world. And we are currently running the largest program in any single hospital at our place. You know, we are doing over 1200 cardiac procedures every year, which means every day 4 to 5 children we are operating, newborn and small babies.
Wow, and the operations work really well.
Yes, so 99% success rate, and our outcomes, we have a tie-up with Children's Hospital of Philadelphia and Boston Children's Hospital, and our outcomes are comparable with them.
Do you have patients that comes out of India? How many percentage compared to, you know, you were in India, in Mumbai, but how many patients come outside, but the percentages of people coming outside Mumbai to the hospital? Do you have many? Or?
So we have a good 1/3 of our patients coming from outside.
Wow.
You know, so 35 to 40% nearly come from outside. They come from other parts of India. They come from overseas. So we have patients coming from Tanzania, Kenya, Nigeria, Madagascar, the Middle Eastern countries. So we do have a large number of patients coming from there because we've also created a system to support these patients to make sure that they are comfortable. So we offer end-to-end services for them from pick up to, you know, visa assistance. We have a completely dedicated international patient lounge where, you know, all their requirements are taken care of. We've got a 40-room relative accommodation set up, so patients who come from outstation can also be accommodated over there. We have doctors coming for training from all these parts of the world, and they also come, they spend 3 months, 6 months at the hospital, because there are many technologies at the hospital which are like first time in India, first time in Asia. So we've got very high-end robotic systems for surgery, the Da Vinci robotic system. So we have doctors coming for robotic surgery training. We've got a total lab automation.
When you talk about robotic surgery, what's that? How is that working? Because it's a new word to me.
Yeah. So many people have this misconception that when you talk of robotic surgery,
it's a robot operating you. That's exactly what's in my head right now.
Yeah, but what happens is actually you have robotic arms. So the machine, yes. So the advantage of robotic arms is the human arms have limitation. My wrist can only rotate 180 degrees.
Absolutely.
You know,
yeah.
But a robotic arm can rotate 360 degrees. Correct. So through much smaller incisions, these arms can be controlled by a surgeon. So if the patient is here, the surgeon is actually sitting there
with a computer,
with a computer, like a gaming console.
Wow.
And you know, he controls the robotic arms.
Oh my God.
And the beauty is that through very small incisions, you are able to operate these patients. You are able to do minimally invasive, much less of blood loss, you are able to preserve a lot of the functions which you would have otherwise lost because of open surgery. And you are able to discharge patients much earlier. Recovery is much faster.
Wow.
So when we started, we were the first hospital in the region to have this robot. And now the workload and the response has been so good that we've gone in and gotten another robot. So we have 2 robots now, and we do about 750 to 800 robotic surgery procedures. Most of them cancerous patients.
Oh my God,
coming in for robotic surgery. So,
do cancer patients get healed?
So cancer today, if you ask me, is the true pandemic that the world is facing. You know, because number one, it's a long-standing disease. Sometimes gets picked up very late, and it needs treatment which could extend for a period of time. Not like you do a procedure and it's over. Sometimes it's a procedure, there's chemotherapy, there's radiation and all of that. But with newer drugs coming in, with newer immunotherapy medications coming in, with the latest radiation oncology, we are able to deliver excellent results to patients. So survival rates of patients with cancer has gone up significantly. And patients are getting diagnosed also much earlier because
of course everybody now is scared. And
so they want to get their health checkups done.
Yeah.
And post-COVID, people have started taking care of their health much more seriously.
Absolutely,
I think, you know. So they come for their health checkups. It gets picked up early, and if picked up early, you know, it can be cured completely. If picked up late, you can still give very good quality life to patients. So, and there's a lot of research going on, and more of personalized medicine has come into cancer. So it's not like one drug which works for everybody.
Of course,
So,
depends on somebody's body and situation.
So you do a genetic profiling of the patient, you do a genetic profiling of the tumor, and you see what meds will work best. And the latest data coming out is very, very encouraging.
Fantastic. Okay. You have been the CEO for how many years now? That position you're in?
Yeah, so I've been working with the hospital now for 18 years.
18?
Yeah, 18 years. So I joined in 2005 when we started conceptualizing and building this hospital. And I've risen through the ranks, and for the last 5 years now.
You joined as who? As just a normal doctor?
Correct. No, I joined on the project side, involved with project planning, part of the core team which was there. And then once the hospital got commissioned, I was heading medical services, then I became COO, and then 5 years ago I became CEO. So risen through the ranks.
So you've been there for 18 years now.
That is correct.
I need to know 2 things from you within the 18 years. One, the worst thing that has ever happened to you in that position, that you sat down and said, I wish I never became this. And another one is one of the greatest things, something very beautiful that happened to you that you will live to always remember. So probably the worst could be somebody's, death or something, maybe a case that happened and you were scrutinized on something because you're the CEO of the hospital. So yeah, tell me the worst. Let's start with the worst and then we'll go to the happy one.
So I won't say worst, but hospitals, like you rightly said, are places where unfortunately there will be negative outcomes at some point in time. And dealing with human emotions at that time can always be very, very challenging.
Absolutely.
So challenging for the doctors, challenging for the staff, nurses, and also as part of leadership, you would want every patient to go home healthy, happy.
Yes.
But there will be instances like that. So there are always instances off and on when there are negative outcomes and patients don't do well, and you feel emotional about it. So that's something that is, I would say, comes with the job, because you are dealing with human lives.
Of course,
And the good part, of course, is the smiles that we get, the blessings that we get, like when we are treating children. We are changing the life of a child when we are doing thousands of pediatric cardiac surgeries. We are healing patients with cancer, with neurosurgery, spine issues. If you have a 85-year-old go back home fully recovered after a spine surgery or a brain surgery, I think nothing can be more satisfying than that.
I tell you.
If you have a child, with a heart defect, operated, successful, the parents come and they just come and express their gratitude to you. I don't think any amount of wealth can replace the kind of satisfaction that you can get. So, I mean, I always feel that I'm really privileged to be in the position.
And it's not about money, you know, it's about that child looking at you smiling, or the parents saying, thank you, I didn't know this would work for me.
Correct.
You're talking about hearts. Now, there are two cases that I've heard. One, somebody says, I have checked and I have a big heart, a bigger heart than usual. Another one says, I have a hole in my heart. What's the difference, and how can we help patients like this, especially with a bigger heart or a heart that has a hole in it?
You know, heart that has a hole usually seen more in children. Sometimes if the hole is very small, it may take some more time for it to get detected. For example, people at the age of 30, 35 sometimes realize when they go for a health checkup that they have a hole in their heart because it's very small, so they may not have realized it, no symptoms. But if the hole is large, very early on, baby could be getting breathless, baby could be getting blue. So nowadays, you know, you have both surgical and non-interventional cardiac procedures as well, through which these patients can be cured and can be given a wonderful quality of life. And we do a large number of such procedures. When you talk of large hearts, most of the times, you know, it could be because of improper pumping of the heart muscle, and blood pressure sometimes can lead to a large heart, uncontrolled blood pressure. So because of the hypertension, the heart has to keep pumping more and more, and it enlarges in size.
How can we squeeze it back?
Yeah, so with medicines. With medicines and various supportive.
So it's not about surgery?
No, usually not.
It's not.
For hole in the heart, yes.
But for
large hearts, usually medical management. Usually,
for the rest of your life?
Correct. Usually large hearts are detected mostly in people who are above 45, 50, 55. Not usually so much in young children.
Tanzania, I am talking to the CEO of Kokilaben Ambani Hospital. He's here in Tanzania, and they are going to work with us. This is a great news. There's a center that's being opened in Tanzania, because I was asking myself, how are we going to work together? We'll be right back. Hard Talk with Mwasha. We talk it hard, really hard. Hello Tanzania, welcome back. This is Lilian Mwasha. I am here with the CEO of Kokilaben Ambani Hospital in Mumbai, India. His name is Dr Santosh Shrtty. We talked a lot about Tanzania, about India, and we're just about to wrap up. There's a lot that I have for him, but I'm so happy that he's in Tanzania, and I believe you'll be back again and again and again, because we're now starting this, we call it what, a family, what is this that we are going to start, you and us Tanzanians? I think it's a family.
It is.
We are a family now.
It is. Yeah. You know, it gives me reasons to keep coming back over and over again, and I'm sure it's the beginning of a wonderful, long-lasting relationship forever.
Thank you so much. Thank you so much. Talking about family, how do you manage? You know, your position is quite high. You have a lot of people looking up to you. You're a father of so many people. How do you manage being the CEO of 1,000+ people with a wife and children at home?
Well, to be honest, I've got a very, very supportive family. So my wife and daughter, they both understand that the nature of my job requires that, you know, there will be times at odd hours that I have to pick up calls. I may have to rush to hospital. I have to deal with people's emotions and all of that. And very often, you know, by the end of the day, when you get back home, you know, you are emotionally so drained.
I know.
That you know, you may not even want to have a long conversation with anybody, but you know, they know me well enough now, and they've been extremely supportive.
What's your wife's name?
My wife's name is Deepa Shetty, and she's a teacher by qualification, but you know, she's kind of given up on her career ambitions because she realizes that with my schedule it's very difficult for both of us to be really working full time. So she's
a homestay mom.
She's a homemaker taking care of my daughter, who's now running 21. So she's in her final year of college.
Wow.
And she's studying finance and commerce. So
she's not a doctor.
She's not a doctor.
Okay.
She's not a doctor.
Okay.
And she is more focused on finance and accounts, and she loves numbers. And
wow.
Yeah,
interesting. Interesting. I've never been to India, but I love Indian food. And there's a lot of spice in Indian food, especially chili. Isn't this something that could bring a problem to women bodies, chili and stuff? Because you eat a lot of chili. How is chili connected to someone's heart and stomach? And
so to be honest,
yeah.
I mean, it's also a bit of a misconception that
yeah.
we eat very, very spicy food.
I
it's
tell
not
you,
like
that's
that.
what we always
so
think.
India is an amalgamation of many communities, many regions, many customs. So you have some states where people love to eat spicy food. You have many other states where they actually, the food is a little on the sweeter side. So it's I would say an amalgamation of a lot of cultures, and a bit of it is also to do with your own genetic profile, the way you've been brought up, the kind of diets that you've been exposed to. So if as a child and you've always been having spicy food, your body is quite used to it.
Does yogurt help?
Yeah.
Because I always see after eating chili that every Indian restaurant has yogurt.
So
how does yogurt help with chili?
Yogurt is an excellent probiotic. It's not only a coolant, but also it improves the good quality bacteria in your gut. So it helps in your digestive process. So yogurt is an excellent probiotic.
Oh, I didn't know about that. Okay. Wow, interesting. So now that you're in Tanzania, we're welcoming you with all our hearts and minds. But how are we going to work together now? Tell us about the communication between Kokilaben Ambani Hospital and the Tanzanians. Are you going to now, because you mentioned Air Tanzania, are you going to pay our flights to come to the hospital? How is this going to work?
So one of the things that, as our chairperson, Mrs. Ambani, always had a vision is in terms of filling up need gaps, not just in the region, but also in some other parts. And since we have always had a very, very good support from Tanzanian patients, we felt that it would be a good opportunity for us to see how we could foster some kind of a collaborative approach. And the best way to do that was to first put our money where our mouth is, or so that's why we said let's start with the coordination center, so that we get to know more about the healthcare systems here, how things are working, and the whole goal being that we want to have a collaborative approach between patients, so that patients have access to the best healthcare services. So we'd like to have our doctors coming on a regular basis, come and do health checkups here, come and do camps here.
Wow.
And to help in diagnosing patients, recommending the appropriate treatments, get some of the doctors from here to come and work with us at our hospital to get them trained and updated with the latest system, so that they can come back here and deliver that level of care to patients here. We can have our surgeons come here, work with surgeons in your hospital here, mentor them, do some of the cases with them. So the whole goal is going to be, how do we ensure that we provide the same world-class care to citizens of Tanzania.
Where is this center located, and what's the name of it? Do we have a person seated at the center who is from your hospital, or a Tanzanian-based person?
So very early on, we realized that it's very important to have a local support.
Absolutely.
To be able to really do justice to an initiative like this. And that's how we connected with David and
David Dixon.
David Dixon. And David actually had gotten his mother for treatment at our hospital, and that's how the connect got established.
Wow.
And with him, we decided that he's the most ideal partner for us to work with, to collaborate, because he has a very good understanding of the local market, of the local needs, the requirements, because he's been involved with many of his businesses here in Tanzania. So we decided to partner with him. So Kokilaben Ambani Hospital, along with his company called Mumbai Healthcare Services, is going to work together to ensure that we are able to provide quality healthcare services to the people of Tanzania.
Wow, this is interesting. I know you're tired, you just landed and you gave me some time to talk to you. Thank you so much, sir. If somebody wants to communicate with you directly, are you an open book? Can somebody email you probably or follow you on Instagram and social media? If you have an email address that people want to talk to you, if it's okay for you to mention it, that's fine. If you don't, then give me a contact that I can, tell people to reach out to you.
And I believe in a very much open office and open communication system. So I'll be more than happy to share my email ID with you. And it's santosh.shrtty@kokilabenhospitals.com, and anybody can feel free to write to me.
Okay. Thank you so much, sir. When are you flying out?
We are launching our office tomorrow, and the day after tomorrow evening is when we fly out.
Okay. Thank you so very much, and looking forward to come to India, but not for hospital basis, just to, because in Tanzania, when somebody is in India, we're always like, oh my God, are you sick? Is everything okay? So I just want to come and have fun and eat some chili and drink a lot of yogurt.
We'd love to play host to you, just like you've been such a lovely host to us.
Thank you so much, sir. It's a pleasure. Thank you so much. May God bless you.
Thank you.
Thank you. Bye-bye. This is Lilian, and I'm done with my interview with the CEO. I am very happy, and I hope you have enjoyed our interview. They are going to come back again, of course, in 2 months' time, as they said, and I will be updating you more on his visit in Tanzania. Kokilaben Ambani Hospital is our family now in Tanzania, and of course Dr. Mwalimu is going to lead us on how we are going to work with them properly. Thank you so much, my dear President, Mama Dr. Samia Suluhu Hassan, for deciding to visit these countries, especially in India. Now all eyes are open. It's easier now for us to have these doctors all over the world coming to Tanzania, and I think Tanzania now is becoming a hub of a beautiful place to come in. When you talk about hospitals, you go to Tanzania, and you want to see mountains, animals, you go to Tanzania. I mean, where else can you go apart from Tanzania? My name is Lilian Mwasha. I love you so much. God bless you. Keep watching and keep following me. Bye bye.
Ili kuwa mwanafamilia bora wa Global TV, usisahau kusubscribe, like, kushare na kucomment. Baada ya kusubscribe, bonyeza alama ya kengele ili kupata taarifa kwa kila video inayopanda Global TV Online.